Okay, and then I'm going to go ahead and mute my. Okay, Jerry, we are good when you are.
Good morning, everyone, and welcome to the June Community Cafe for Partners Health Management. Thank you all for joining. I'll introduce our speaker in just a moment, but I would want to welcome each of you to show us your smiling faces and join us live. We respect if you're not in a position to do that, but we do want to make these interactive, and that always helps. With that, we will use the question and answer box if you have any questions during this session. So you feel free to use that if you have any questions. So with that, again, welcome to the June Community Cafe. And I'm introducing to you Carla Bradshaw, who will be speaking about our topic today. Thank you.
Thank you, Jerry. My name is Carla Bradshaw. I work with Partners Geriatric Adult Specialty Team. We provide education both in long-term care facilities and all kind of community agencies that provide senior services. We are a grant, and so our series are free. There's no charge, but we do have designated areas and agencies that we are allowed to train by the grant, but they're fairly broad. And at the end of this, I'll have a little list of ways that you can contact us if you're interested in scheduling a training for your agency. I'm going to share the screen while I talk because I have a PowerPoint presentation that we're going to do today. June is Alzheimer's Awareness Month and Brain Awareness Month, and we thought this would be a good time to offer some education available on Alzheimer's disease. And so the PowerPoint I'm going to go over and the discussion is going to be an overview of Alzheimer's. It's in this amount of time, there's a limit to how in depth we can go, but we're going to really try and provide you with as much information as we can. In this, we're going to define what Alzheimer's disease is. We're going to give you some facts about Alzheimer's. We're going to go over some of the symptoms because people always have questions about early symptoms, and that is very important. As many people in the public as we can that can become familiar with Alzheimer's symptoms, that's better because early intervention can be very helpful. We're going to talk about what happens in the brain in Alzheimer's disease and a little overview of the treatments. The reason we have chosen Alzheimer's because there are a lot of different types of dementia, but in this country, Alzheimer's disease is the most common cause of dementia. Dementia is an umbrella term. It's an overall term. There's many different types of dementias. And when a person has dementia, we see a decline in their ability to think. It also affects how they behave. It affects their ability to socially interact with other people. And like I said, dementia is an overall term. It's an umbrella term. It's like if you said, if you had two fellows standing there and both of them had heart disease, but one of them has had a heart attack and one of them has congestive heart failure. Those are two different things. Two different things have damaged their heart, but it affects how their heart functions. So you say, they fall under the umbrella of heart disease. Well, dementia is an overall term too. It means that something has caused damage in the brain and it's affected the brain's overall functioning to a degree that a doctor has diagnosed them with dementia. And Alzheimer's is a specific type of dementia. And it triggers a decline in the person's thinking skills. Now, with Alzheimer's disease, the damage that Alzheimer's causes gets worse over time. And eventually it's going to affect the person's ability to do all the things that they need to do. And over time, they're going to need more and more help as time goes by. Alzheimer's also slowly worsens. It is progressive, and that means that once it starts, it continues to slowly get worse. There are no pauses. There's not any time that it stays the same. It very, very slowly progresses. It causes brain cells to waste away and to die. And over time, the person slowly loses more and more brain cells. Another thing that happens in Alzheimer's is the person's brain cells have problems communicating with each other. So there's actually two problems going on in Alzheimer's. As I said earlier, Alzheimer's is one of the most common dementias in this country. It affects almost 6 million Americans aged 65 and older. Last year, there were 5.8 million Americans in 2020 living with Alzheimer's. Of those folks, 80% were age 75 and older. Approximately 1 in 10 people age 65 and older, or 10% of folks in that age group have Alzheimer's dementia. Almost 2/3 of Americans with Alzheimer's are women. And part of that is because of that women live a little bit longer than men overall. Older African Americans are about twice as likely to have Alzheimer's or other types of dementia as older whites, and Hispanics are about 1.5 times as likely to have Alzheimer's or other dementias as older whites. And now when they get those figures, they are combining all the types of dementia together. And that includes another type of dementia called vascular dementia, which has there's a link with vascular dementia to medical conditions, such as hypertension, heart disease, a history of strokes. And when you get into those sort of medical conditions, there is some link with family history and with disorders that you inherit or risk factors that you inherit. So ethnic background tends to take a little bit more precedence in vascular dementia than it does with Alzheimer's. So it's a little misleading in that if you think of that as only with Alzheimer's, but they are including all the other dementias in those stats. So there's some slight differences in different ethnic groups. Alzheimer's as a disease is now the 6th leading cause of death in the United States. That helps put a little perspective on it. We have a larger aging population as the segment of our population as the baby boomers age into the older group. And that just started a few years ago. That will continue to increase because as more and more baby boomers move into the over 65 segment, that's going to make all disorders that affect older people be a larger percentage than they were before, because a larger percentage of the population is. To give you a little example, I've been with the Gero team since 2011. The first time I taught dementia classes, Alzheimer's was the 8th leading cause of death. So you can see it's already jumped to 6 just while I've been doing this job. And that's the beginning of this increased older segment of the population. Alzheimer's is now the 5th leading cause of death among people 65 and older, if you only look at the older age group. And of course, it's a leading cause of disability and poor health in older Americans. 1 in 3 seniors dies with Alzheimer's or one of the other types of dementia. So it's a frequent cause of death in the older population. It also involves a large segment of the population so far as family caregivers and other folks who provide support for people with Alzheimer's. Estimates are there are somewhere in the neighborhood of 16 million Americans providing unpaid care for people with Alzheimer's and other dementias. And just an idea of what that represents, if those were paid caregivers instead of unpaid caregivers, that would be in the neighborhood of $244 billion worth of care provided by family members and other unpaid caregivers. So that's hours and hours of labor there that's volunteered by family caregivers. Just a little look at who those caregivers are. About 1 in 3 caregivers is also 65 and older. About 2/3 of caregivers are women. About 1/3 of dementia caregivers are daughters. Most caregivers, about 66% of them, live with the person with dementia in the community. And about 1/4 of those are what we call sandwich generation caregivers. And having had personal experience being a sandwich generation caregiver, that is seriously a stressor, because what the sandwich generation caregiver term means is that you have a person, a lot of times it's a daughter, but a person that is not only caring for an aging parent, but they also still have children under the age of 18 in the home. So talk about being pulled 2 directions with multiple responsibilities. But about 1/4 of caregivers of folks with dementia are sandwich caregivers. Alzheimer's takes a toll on caregivers too. When you compare that with caregivers of people that don't have dementia, twice as many caregivers of those with dementia indicate that they have emotional, financial, or physical difficulties. It is a difficult job and it is a stressor and it can really wear you out. Those are folks that need support. One of the questions that comes up frequently when we're talking about Alzheimer's and get into an introductory sort of discussion are, what are the earliest signs? People want to know because they worry about it. If you've experienced changes or you have a family member experiencing changes, some of the dementias tend to have certain symptoms first. And that's true of Alzheimer's disease. It's pretty across the board that with most people who have early signs of Alzheimer's disease, the first sign is very frequently forgetting things that happened recently. And that happens because of where Alzheimer's starts in the brain. You may also see that they've noticed that they forget recent conversations. Now, as the disease progresses, of course, the person with Alzheimer's memory is going to get worse. But remember that early symptom, forgetting things that happened recently and forgetting recent conversations. At first, the person with Alzheimer's disease may realize that they're having trouble remembering things. They may recognize that they are having trouble organizing their thoughts. But after a while, a person who has Alzheimer's disease becomes less aware of their losses. And it's more likely that a family member or a friend are going to notice the symptoms worsening. In other words, it bothers them to start with, but after a while, they're not bothered by what they don't remember as much. And speaking of memory, and this always starts in every discussion when you talk about memory, everyone has occasional memory lapses. And people always, especially people that are my age, when you start talking about memory loss, they're like, God, I forgot this and I forgot that, and they start worrying about it. But everybody has occasional memory lapses. This happens most likely if you're very tired, if you're very stressed out, if you've been sick. as a person that recently went through an injury and a surgery, I can tell you after anesthesia and a whole lot of pain, it affects your memory too. I literally have a blank spot there. And when I went back to, picked up again at work, I had to go back through notes, go back through checking stuff. And usually my memory is pretty dependable. It's like it just didn't work there for a while. So when you're sick or when you're tired or when you're stressed out, it's normal to occasionally forget things. It's normal to sometimes have to search for your car keys. It's normal to forget the name of the person that you just met. When you're tired, when you're stressed out, or when there's something going on, everybody has an occasional. But when we talk about memory loss in a person with Alzheimer's disease, it's different. Their memory loss is present all the time, and it continues to get worse over time. Their memory problems make it hard for them to function. If they're still working, they'll definitely start having difficulty at work. It'll cause them difficulty at home too, managing things. The person with Alzheimer's may also start to repeat statements and repeat questions over and over. They will forget conversations that you've had with them. They will forget appointments, especially those that are recently made. They will forget events that they meant to go to, and they do not remember them later. And that's kind of an important point for Alzheimer's. It's because they're not making the new memory. So if I get stressed out this week and forget that I have an appointment on Friday and they call me and say, hey, you missed your appointment. You're like, I knew it. I knew I had a 2:00 appointment. What? I just got busy and forgot it. That's not the way the person with Alzheimer's is. The person with Alzheimer's is like, no, I don't have a 2:00 appointment, because that memory didn't make like it should. They also start to routinely misplace possessions. And they often, and this is sort of a classic Alzheimer's, they put them in very illogical locations. And if you're helping a person with Alzheimer's try and find something, don't necessarily look where it's supposed to be. Look everywhere. I love this picture of the car keys in the refrigerator, because that's a perfect example of, they're not hung on the rack. They're not laid on a table surface. They're somewhere really weird. And they tend to misplace things in the oddest places. People with Alzheimer's may also get lost in familiar places. They will eventually start to forget names of family members and everyday objects as the disease progresses. They'll have trouble finding the right words to identify objects. They will have trouble expressing their thoughts because they start having problems with language, both expressive and receptive language. They'll start having trouble taking parts in conversations, especially if it's more than one-on-one conversation. If there's multiple people talking, they have trouble switching back and forth. And also they have more trouble if the environment is noisy and busy and crowded. Alzheimer's disease causes difficulty concentrating and thinking, especially fairly early on, about abstract concepts and numbers. So as you can see, one of the first problems, a lot of times one of the first things noticed by family members is they start having trouble paying bills and managing money, because that's not, to make change is a direct task. But to look at your bank account, to look at when your money's coming in, to look at all your bills that are due, figure out which one to pay in which sequence, keep up with all that, that's more higher level thinking, more abstract concepts, and it has to do with math. Multitasking starts to be exceptionally difficult for people with Alzheimer's in the middle stages. Usually, like I said, managing money, balancing checkbook, paying bills on time is a fairly early symptom. Those difficulties are going to get worse, and eventually the person with the Alzheimer's will not be able to recognize or deal with numbers at all. Their ability to make reasonable decisions and judgments in everyday situations will start to decline. They may make poor or uncharacteristic choices in their social interactions. They may have trouble dressing, and usually the first thing is the choice of what they wear. Eventually, Alzheimer's will affect their ability to do some of the fine finger movements that have to do with buttoning buttons and zippers. But the first thing is usually the appropriateness of the choice. So what you will see is clothes that they choose being the wrong thing for the weather. So too warm a clothes for the temperature outside, or not enough clothing for if it's cold outside, or the subject of their clothes. For example, they may be planning to go out and work in the yard, and instead they put on their Sunday pants. Okay, so it's more choosing clothes that aren't right for the situation that happens first. Later, dressing becomes more of a struggle. Because of the way Alzheimer's affects their judgment and their decision making, when something happens that surprises them, that's when you'll see symptoms first. It becomes more difficult for them to respond effectively to everyday problems. So if they're cooking and food catches on fire on the stove and they have to do something quickly, or say they're driving somewhere that should be familiar to them, but they come up on a road closure and have to go a different route, they can really struggle with that. That happened to my mom early on. She had dementia, but it was early on and she was still functioning very well. And she was driving in a town that she was very familiar with, but she came up on a road that was closed and had to go a different way and got so anxious of it. And actually, I'm kind of glad it happened because she was a lot more responsive after that. I mean, that caused her to really have insight that, hey, I'm struggling with this, and would you mind driving me next time I have to go to town? That's always helpful, because sometimes it's a struggle to get folks with dementia to agree that maybe it's time they quit driving. Planning and performing familiar tasks. Once routine activities that require a series of steps, like planning your grocery shopping, figuring out which meals you're going to cook which day, cooking that meal, that's a multi-step thing. They start struggling with that. Maybe playing games that they've enjoyed as an activity is more of a struggle as the disease progresses. Eventually, as Alzheimer's becomes just advanced, they're going to start to forget how to perform the most basic tasks like dressing and bathing. Alzheimer's can cause personality and behavior changes because the damage that's going on in the brain can affect brain chemistry. It can affect the mood. And as it damages different areas of the brain, it can affect behavior. So there's a lot of things related to personality and behavior that you can see. People with Alzheimer's have a significant risk to have depression at times, and that has to do with the brain chemistry. A fairly early symptom you may see is just general apathy and some social withdrawal. They have a problem with mood swings sometimes. Sometimes you will see doesn't necessarily have to be a full-blown paranoia, but it can be. But a lot of times it's just a general distrust of other people, a suspiciousness. That's a mild version of that behavioral symptom. In some folks later on, it can show up as actual paranoia, where they are fearful and afraid somebody's going to hurt them or do something to them or take their things. They can have some irritability. Later on, in some folks, you can even have aggressiveness if they get upset. Changes in their sleeping habits become a problem in the middle stages of Alzheimer's. There's also a possibility of wandering, which can lead to getting lost or getting hurt. They may lose their inhibitions somewhat. That's more of just generally not being aware of the situation and surroundings. And as the brain sustains more damage, some people with Alzheimer's can even have some delusional thoughts, like believing something's been stolen A lot of times that something was just mislaid or put in a place that's not obvious and they've lost it. But if you combine some suspiciousness or slight paranoia there, it's real easy to make the jump that, hey, somebody stole it. Now, even though the person with Alzheimer's throughout the process of the disease is continuously, gradually, slowly losing skills, we know that there's some abilities that are retained longer. And these are important when you're a caregiver and you're trying to utilize as much as you can. And you want to encourage activities that involve the skills that are retained longer. Some of the examples of skills that are retained longer are listening to books. They lose the ability to read, but they can still listen to books or stories because their long-term memory, the memories from years and years ago are more intact for longer. They enjoy reminiscing. They really enjoy things that are related to music. So singing or listening to music, especially music from their younger adult years. Some of them still enjoy dancing. If they enjoy drawing or doing crafts, a lot of times they're able to still do a simple version of that. These skills are preserved longer because they're controlled by parts of the brain that are affected later on in the disease process. So you always want to plan activities and interactions with them that highlight these skills that are retained longer. What happens in the brain with Alzheimer's? There's a lot we know about what happens. Unfortunately, there's not a lot of treatments that can stop what's happening. But we've learned a lot in the last 20 years. Researchers think that changes in the brain that take place with Alzheimer's actually start up to possibly 10 years before you can actually see symptoms, like the short-term memory loss that make it obvious the person's having problems. So if Alzheimer's is more common after 65, if you are going to develop Alzheimer's symptoms at age 70, then that means at age 60, probably the very earliest changes of Alzheimer's begin in the brain. But it's a slow progressive progress. So the Alzheimer's has to advance enough in the brain and reach an area that's going to cause symptoms before anybody could possibly diagnose it. There's no way to diagnose what they refer to as the preclinical stage of Alzheimer's. The people that have that are completely symptom free, but the early toxic changes are already taking place in the brain. People have questions about what happens in Alzheimer's, and I'm going to go through a fairly simple explanation of it. But basically what happens in Alzheimer's is two proteins normally found in the brain start to act abnormally, and they cause toxic changes and changes that interfere with communication in the brain and damage brain cells. One is inside of the brain cells, and the other protein is in the space between brain cells. I'm sorry, did not mean to hit that. This is a drawing of it, but this kind of helps explain it. The purple neurons there are brain cells in that picture. And inside of the brain cells, people with Alzheimer's develop a problem with neurofibrillary tangles. Then in between brain cells, people with Alzheimer's develop problems with amyloid plaques. So the tangles are inside of brain cells, the plaques are outside in between the brain cells. And I have a much better picture here than the National Institute of Health. And these are some of the best pictures I've seen so far as explaining it. And they're color highlighted so you can really see it. One of the proteins that act abnormally in Alzheimer's is called beta amyloid. And what happens when beta amyloid starts acting abnormally, it forms plaques in between the brain cells. And those amyloid plaques interfere with communication between the cells. And the amyloid plaque there is represented by that brown part of the picture. And what it looks like, those plaques look like kind of broken pieces, sort of rounded, kind of like if you're from the country like me, kind of like one of those big round hay bales. But those are broken pieces of beta amyloid, and they clump together and form that amyloid plaque. Now that amyloid plaque is irritating to the brain. It's not supposed to be there. And because they're in between the brain cells, the little ends of the brain cells can't reach good to communicate. So the amyloid plaques interfere with communication and they're irritating. The other protein that acts abnormally in Alzheimer's is called tau, T-A-U. And tau starts to form tangles inside of brain cells. And in this picture, the tau tangles are highlighted blue. And this makes it so much easier to understand. I love these pictures because they form kind of twisted strands inside of the brain cell. Now, those tangle strands keep the brain cell from working properly, and the brain cell can't absorb enough nutrition to stay healthy. So the brain cell starts performing poorly, then it gradually shrivels up and it dies. Now, we have millions of brain cells, but if you're very gradually, day by day, losing brain cells one after another over time, it affects the overall brain. This is a draw picture, but it's kind of good to understand how Alzheimer's spreads. With people who are in the early preclinical stages, their brain looks like the top picture there. The blue part represents Alzheimer's damage. That's where this person's having Alzheimer's plaques and tangles. And that little tiny bit of blue in that first picture, that's the place that Alzheimer's begins. Now, at that preclinical stage, of course, there are no symptoms. By the time you get to mild to moderate Alzheimer's, it's started to spread. And in that middle picture, you can see where it's spread up and up to the top and then towards the back. And then by the bottom picture, that represents severe Alzheimer's disease. Some people call it end-stage Alzheimer's disease. And as you can see, that blue has spread all within the brain. So Alzheimer's damage has basically reached all areas of the brain. Now, if you look at that top picture, it's a lot bigger than the bottom picture. That's because the brain tissue has literally shrunk. So the size of the brain is actually smaller due to the damage from Alzheimer's. The first damage that takes place in the brain of a person with Alzheimer's is right next to the part of the brain that's essential in forming new memories. So by the time it spreads to the area that forms new memories, that's when you become to get the first symptoms of Alzheimer's disease. And that's why the first symptom with Alzheimer's is always short-term memory loss. Currently, we have several treatments for Alzheimer's disease. There are some medications that are FDA approved to treat Alzheimer's. And since they were developed and came on the market, they're also found to be useful in other types of dementia too. They were tried and they were helpful. Now, the medications that we have do not stop the progress of Alzheimer's disease in that we don't have a medicine that can stop tangles from forming. We don't have a medicine that can stop beta amyloid plaques from forming. What the medications we have now on the market for Alzheimer's do is there's two different types, and they affect brain chemicals that are low or damaged or out by Alzheimer's disease. So they can temporarily improve symptoms. They can help the person to think a little bit better. They can slightly slow the rate of decline and help the person maintain ADL abilities a little bit longer. So the medicines temporarily help maximize function and maintain independence, but they do not work. They don't stop what's going on. They help slow the person's loss of cognitive function. But the earlier they're started, the more they help. So early diagnosis is always important. There's also different programs and services that can help support people with Alzheimer's disease and their caregivers in the community. And it's important that folks learn what's out there. There's not currently a treatment that cures Alzheimer's disease or alters the basic disease process. By the time they get to the advanced stages of the disease, they start to suffer complications from severe loss of brain functioning. Frequently in the late stages, dehydration and malnutrition or infection are all a problem. One of the common problems at the end stage for people with Alzheimer's disease is difficulty swallowing. They start to lose some of their ability to swallow, so they're at risk to aspirate. One of the things that's important so far as community education is people learning some of the general early symptoms, memory loss, that's significant changes in ADL abilities, learning when to see a doctor, not automatically assuming that things are age related. But remember, there are a number of different conditions, many of them treatable, that can result in memory loss and some of the dementia symptoms that we talked about. That doesn't necessarily mean the person has dementia. There could be another medical condition that's not diagnosed that could be treated. So anytime a person is concerned about their memory or their thinking skills, it's always important to make an appointment and talk to your doctor, have a thorough assessment and diagnosis. There's no benefit to ignoring it and being afraid to go in. If you're concerned about thinking skills that you observe in a family member or one of your friends, talk about your concerns, encourage them to go to the doctor's appointment, help them make the appointment, offer to go with them. That can be helpful. If it does turn out to be Alzheimer's disease, early diagnosis is important. The medications work better early on. They're more helpful. It helps to preserve some skills. You have a family has a better idea of what the person's needs are going to be. You have time to plan and to find out what's available. But I think a lot of times folks are afraid. They don't want to hear the answer. And again, it could be something simple. It could be a medical condition that's affecting. There's lots of things that can affect how we think. Some examples are like, it could be something endocrine. It could be an underlying infection a lot of times will cause difficulty in thinking. Depression, untreated depression can cause difficulty thinking. So there's a number of medical problems that could be the result, could be actually what's causing their memory loss or their struggle. And again, if it is an early symptom of dementia, being able to plan ahead of time and provide what they need in order to maintain independence as long as possible is important. We're going to take questions. I know that I had to go through that really fast, but I had to kind of fit the time constraints of the community cafe, and I wanted to make sure that we had time to answer questions. I understand that was kind of an overview, and we had to go and just sort of hit the high points. But GAS is available for trainings. We have a lot more in-depth trainings on the different dementias. We have trainings on, we provide trainings on mental illnesses, and also with specifics of how that looks in older adults and particular risk factors for older adults. And we also provide presentations on substance abuse in older adults. So mental illness, substance abuse, and then we cover all of the different cognitive impairments, all the different types of dementia. We have some specific ones on dementia caregiving. We have some presentations about dealing with behaviors, communicating better. So if you're interested or think that or have questions about whether your agency or group is covered and GAS can come, we would be glad to do that. All of our trainings are available on Zoom. We're starting with some folks if they want in-person training. We're starting to do those. Some folks, depending on where they are in their COVID precautions and We're sort of a mixture right now, but we're available either way. I've got the slide up now that tells our staff. Stephanie Engel is our team leader. There's myself, Bethany Ramos, and Krista Barbie. So we have 2 therapists, a qualified mental health professional, and a nurse, and all of us train. The email address for GAST is on the current slide. It's gast@partnersbhm.org, or the number is 704-884-2504. If you have questions about our service and would like to schedule a training or just have some general questions about what trainings we have available, we would be glad to answer your questions. And now I'm going to turn it back over so that they can let me know the questions that you have.
Thank you, Carla, and we greatly appreciate your being willing to come on and share the information.
Thank you.
Having dealt with it personally, I found a lot of it's very interesting, and I think a lot of us have dealt with this in our lives at some point. So I think it provides a great overview and helps us all. So what we want to do is we've enabled the chat box because the Q&A apparently isn't working. But if you have a question, if you want to type that in the chat box, we will then unmute you and you can speak, or you can go that route, whichever you prefer. We do want to make it interactive, but while we're doing this and checking, we are going to have some poll questions up, and we really would appreciate if everyone would answer these questions and give us information on that. And so, Carla, I had one question to open with was, is there a particular demographic that statistically is shown to be more susceptible to Alzheimer's, or any information related to that?
For Alzheimer's, it's pretty much, no. Alzheimer's is pretty much affects every group. There are some groups that are at higher risk for Alzheimer's disease. And maybe that's an important point to have here. Research has found that certain groups with certain medical conditions or things that have happened, certain particular traumas. One good example is people with Down syndrome or IDD diagnoses, but particularly people with Down syndrome are at higher risk to develop Alzheimer's, and they tend to develop Alzheimer's younger than normal. So they're more likely to develop it possibly in their 50s rather than their 60s and their 70s. And that's important for family and caregivers to know. And what's important to note is if they have a decline in their abilities, whatever their ability level was for most of their life, if they start losing some of those abilities, it's important to take them in for a checkup and assessment, because it could be that. Another group that is at increased risk for Alzheimer's is people who have had a TBI or people who have had multiple head concussions. Any type of head injury they've found increases your risk. They did a study, about 2012, I think it finished. Well, if y'all are football folks, whenever they started putting the big fines on the helmet to helmet hits, that was at the end with that, once that study came out. But they wanted to research people who had frequent concussions. And I think being an NFL player is probably one of the riskiest ones as far as frequent concussions. So they studied all the retired NFL players for a period of time. And what they found was that they were 4 times as likely to develop Alzheimer's as the general public. So that's another group that's high risk. Anybody that's had multiple concussions, or of course a documented TBI. If you bang on the brain, there's several conditions that increase the risk later on for some neurological stuff, and Alzheimer's is one of them. So that's another risk factor. But there are certain groups that have an increased risk. Now that doesn't necessarily mean that they're going to develop Alzheimer's, but their risk factor is higher. There's a very rare type of Alzheimer's, much, much smaller segment that is actually genetic. There's certain families that have, they carry a flaw on a certain gene that if you inherit that flaw, you will develop Alzheimer's. But that's a very rare type of Alzheimer's. That again is a young onset. But that was discovered and they studied some families and they identified which gene that was on. But like I said, that's only a small, that is not the regular everyday Alzheimer's that you see. But thanks for that question. That gave me a chance to mention there are a few high-risk groups. But anybody with changes needs to see the doctor. That's, even if the age is a little off what you're used to or what you've read, it's still better to get it checked out because there's a number of other medical conditions that also could be causing the symptoms, or it could be a different type of dementia. For example, like vascular dementia or Lewy body dementia or Parkinson's disease dementia. There's a number of other dementias that also could be.
Thank you, Carla. Are there any other questions from anyone? I think we've got it to where you can unmute, or Abby can unmute you.
It is able, you can unmute yourself when we have two people with their hands raised. So first, Amy, if you want to go first with your question, you can unmute yourself and ask it.
Yes, thank you so much. Carla, you were talking about that there's no cure, but there's some treatments for specific or symptomatic. Can you go back over that part?
Oh, sure. I'm sorry. There are some medications that are prescribed when someone has Alzheimer's disease. They are more helpful in the early stages and less helpful later on. One class of drugs, there's 3 drugs in that class, that they can help raise levels of the brain chemical acetylcholine. Acetylcholine is important in thinking, and acetylcholine levels can be low in people who have Alzheimer's disease. So you're helping the person, but I want to make it clear that's not treating the Alzheimer's plaques and tangles. We don't have any medication that can stop the damage, what's causing the damage.
Right.
But that can help the person's thinking to clear slightly, and it is minimum. I don't want, but that can be important. You know, I know in the case of my mother, I can give you a personal example. They started her on medication, but she did not have Alzheimer's. She had vascular dementia, but they also use these medicines and that because the same thing, the damage is affecting those chemicals. And she struggled to speak. She probably could get 2 words out of the sentence she was trying to say at that time. When they started the medication, she did have really what more than I expected, a dramatic improvement in her speech. But like I said, that was the symptom that she had struggled with the longest. It was not that dramatic later on. It probably helped slow the process a little bit, but it allowed her to better say what she was trying to say. And I think it maybe helped her with her ADLs a little bit longer. It is, these medications are minimum, but they're, you know, when you're slowly losing ADL abilities, every little bit that you can preserve, that you can continue, is a benefit for the person with dementia. It's a benefit for their caregiver. But like I said, there's 3 drugs in that category, and those are used from one of those 3, whichever one they choose, is used from the earliest stages of the dementia. There's another drug family, and there's only 1 drug in it, that affects a different brain chemical, and it's used from the middle stages on towards the end. And eventually at the very last stages of Alzheimer's, the drugs are probably not much benefit, but that's better a discussion with the doctor and a time and the particular person. But those, I wish we had more. They're still researching drugs. One of the things they were researching was there were several drug companies that were researching about the amyloid stuff. There's one that, and I'm not real up on this yet. I've just read some of the preliminary articles, but there's one that I think they were going to do an approval that had to do with, the drug had to do with beta amyloid plaques. And there was some controversy about the studies, about how helpful it was, but I think they decided to do, they were maybe going to do a temporary, like a time limited thing and see how, if it was helpful. But so far as what I was in coming down the pike, I'm not real up on that, but they continue to experiment and to research and to try and find, something that treats both components. This is going to affect a large segment of the population, and that segment keeps getting larger. And I will definitely say personally, I wish there was even more research and more money that had been put into that. Some things you never know whether there's going to be a cure found, but when it affects a large number of people and their quality of life that much, I hope that we continue to research it. And I hope someday there is something that can at least slow it, but hopefully, people will live longer from maybe what they find out.
Yes, ma'am. Thank you so much.
You're welcome. You're welcome.
All right, and Jerry, I will go ahead and call. There's one more person with their hand raised. April, you should be able to unmute yourself. And I will say, while I have a minute, we're coming up close on time, but we will have this recording available to send out afterwards. And Carla, one person did ask if we can include your slides in that. Is that okay for us to do? Or do I
No.
need to reach out to you?
They did. Well, we typically don't on the gas presentations, but I do have a number of brochures and stuff, hand out, flyers from the
Okay.
National Institute of Health, and I would be glad to share that. So if they could reach out to me, or if you could forward it to
Okay.
me, I could email them some information on Alzheimer's that
Okay.
would.
I'll include your contact information and the gas team contact information in the email sent out to everybody who registered.
Yeah,
Okay.
and we'd love it if anybody, if anybody wants to schedule, it's fine to use that and contact us, and we'd be glad to answer questions.
Okay, and we've got one more. So anybody else, if you have something on your mind, you want to go ahead and ask, now is the time to do it. But April, we'll go ahead with you.
Carla, thank you for your presentation. So what are some of the criteria that doctors use when they're assessing an Alzheimer's patient to determine when they need more skilled nursing care rather than just, a family caregiver or a sitter type situation?
Well, it would basically be the same criteria as skilled nursing, period. That's kind of a long question. It would depend on not only how advanced their Alzheimer's were, but also particular medical needs. Because remember, this is an older person, so they may also have some medical conditions. And it's varied. It has to do with how much help is available at home, what the circumstances are. So I guess the broad answer to that question is it depends on the person and the stage they're at. But just staying in contact with the doctor, taking the person in, letting them know what's going on, what abilities there are. There are a number of levels of care if the caregiver, if the home caregiver starts needing help or the person needs placement. There's the assisted living assisted living level of care. There's a memory care at assisted living level, and there's not a lot of those, but there are assisted livings that have a memory care unit. There's a few of them in each county. Then you have skilled nursing, which is nursing home level, and there's even a couple of those who have specific memory care units. But the doctor can, depending on the person's condition, can help the family to decide when that's necessary. And some families, depending on the amount of caregiver resources they have and people available to help, choose to try and maintain at home for much longer. Like I say, it's very individualized, and it depends on what's available to the person and to their family.
Abby, are there any other questions in waiting?
No, I think that's it.
All right. Thank you all for joining us today for our community cafe. Our next cafe will be at 10 a.m. in July the 28th. And we'll be doing a update on Medicaid transformation and expect some partner staff to be on the call, possibly some other people giving their perspective. We invite you all to join us for that and invite other people, anyone in the community, stakeholders, providers. It's open to anyone that would be interested in participating. We are looking for your feedback on how to make these cafes meet your needs and share information such as what Carla gave today and other subjects that are relevant to you. So please don't hesitate to let us know what you want to hear about as it relates to providers and stakeholders in the partners area. So with that, again, thank you to Carla for being willing to share this with us. And thank you all for joining us today, and have a wonderful day.
Jerry, you did say, this is a Wednesday, July the 28th at 10, correct?
Yes, ma'am, Amy.
Okay, thank you so much. And thank you, Carla.
And you can go.
You're welcome.
And it's all the information is on our website. You can pull it from there, and we will be sending out through the collaboratives as well. But you can go to the partners open website and see that information about how to sign up. And the great news is if you have the option to sign up for all of our future trainings that are listed on the calendar. So you can click it one time and reserve this time on your calendar each fourth Wednesday of the month.
Thanks, everybody. Have a great day.
Thank you all.